Heart failure is the physiologic symptoms that occur because the heart isn't pumping blood effectively. The symptoms of heart failure are shortness of breath, weight gain, fatigue, not being able to do the things that you were able to do previously. Heart failure usually occurs in a slow, insidious process, so the symptoms are very vague initially and gradually get worse, so that people are sometimes surprised that they have heart failure because they didn't feel it coming. There are a variety of types of heart failure. From a patient standpoint, they don't really make that much difference because the symptoms are all the same. The shortness of breath, the fatigue, the not feeling well. The most common cause of heart failure in the United States is ischemia, or lack of blood flow to the heart muscle. The risk factors for heart failure are very similar to the risk factors for coronary artery disease. Diabetes can put you at higher risk for having heart failure, particularly if it's poorly controlled diabetes. Hypertension or high blood pressure can put you at much higher risk, particularly after years of uncontrolled high blood pressure. Diagnosis of heart failure usually starts at your primary care doctor's office. Heart failure by itself does not mean it's the end of your life. What it does mean is that you need special attention. One of the most important physicians on your team if you have heart failure is the cardiologist. The cardiologists focus on the latest technologies and drug therapies that are used to treat heart failure. For any heart failure patient, there are some key things that they need to know about when to call their cardiologist. Gaining weight of 2 pounds or more overnight or 5 pounds in a week can be a sign that a patient has held on to too much water. If a patient holds on to too much water, the next symptom is usually shortness of breath. If a patient has shortness of breath that is worsening over time, they need to be in touch with their cardiologist. Anytime a patient cannot lay down in bed because they are short of breath, they need to call their cardiologist. If a patient feels the need to sit up in a chair all night because they can't lay down at all, they need to call 911. The medical therapy of heart failure is very individualized. Once you have heart failure, the whole goal of your therapy is to slow the progression of disease. This can be done with the medications, adherence to the lifestyle changes that are key to the treatment of heart failure. One of the main problems with heart failure is the fluid retention that can occur because the heart's not pumping well. So adherence to a low sodium diet is very important. Watching the amount of fluid intake is very important. Maintaining an active, healthy lifestyle is important for a sense of well-being, but also for decreasing the symptoms of heart failure. The Franciscan St. Francis Heart Failure Care Clinic is a multidisciplinary team of professionals that are all working together to care for patients with heart failure. We are one of the few hospitals in the state of Indiana that have the heart failure accreditation from the Society of Chest Pain Centers. We have heart failure trained physicians, we have heart failure trained nurses, we have heart failure trained pharmacists who also provide additional education for the care of the patient. One of the most impressive things that St. Francis Hospital has done through the course of their heart failure accreditation is establish a heart failure nurse navigator. She talks to the patient and their family regarding why the patient is here, what their concerns are. She also provides them with the information about heart failure, what it is, and what they can do about it. If a patient is at high risk for having a problem after discharge, she makes the appointment for them with their primary care physician or the Franciscan St. Francis Heart Failure Care Clinic for a close follow-up appointment. Caring for the multiple disease processes that can lead to heart failure is key to preventing heart failure. caring for the high blood pressure, the coronary artery disease, and the diabetes can prevent and slow the progression of disease for heart failure.